Hello everyone, my name is Isabella Hiake, and this is an academic presentation for my Human Resources Management in Healthcare class. Today, I will be discussing the case study titled, Should She Be Disciplined for That Instagram Post? From American Public University Systems Medical Center, Pediatric Oncology Unit. This case involved Samantha Lee, a well-liked pediatric nurse who posted a sarcastic comment on Instagram about the hospital's model celebration for the opening of its renovated oncology wing. While she did not violate Health Insurance Portability and Accountability Act, her post tagged the hospital and was viewed by families and staff, ultimately raising concerns about professionalism and the hospital's reputation. The central issue I want to address today is whether Samantha's post warrants disciplinary action and how HR should respond when employees' free expression conflicts with organizational integrity. Let's dive into the professional and organizational standards. Did Samantha violate professional or organizational standards? I would say yes. Even though Samantha did not violate HIPAA, she did violate professional expectations related to professionalism and respect. Per the Professional Nursing Standards, the American Nurses Association emphasizes that nurses must uphold professional conduct online and avoid posts that undermine public trust in the nursing profession and their employer. Samantha's sarcastic caption publicly criticizes her workplace and could be interpreted as disrespectful to organization. Regarding organizational standards, American Public University System Medical Center has a code of conduct discouraging public criticism. Even though it lacks a formal social media policy, code of conduct still apply in digital spaces. Repeated negative posts show a pattern on unprofessional behavior. Nurses' legal, ethical, and reputational risks. Moving on to question number 2. What are the legal, ethical, and reputational risks? For legal risks, there is minimal HIPAA risk since no patient identifiers were shared. And there is the potential of creating an environment where patient families question the quality of care. For ethical risks, nurses have an ethical duty to foster trust in the healthcare system, and public negativity can harm morale within an already sensitive pediatric oncology unit. And for reputational risks, there is evidence because parents already complained after seeing her post, and negative public perception can spread quickly through social media, and this can impact funding, donations, patients' confidence, and community trust. According to Sampson and Fried, employee conduct outside formal work duties can still influence organizational credibility, especially in healthcare settings where public trust is fragile. To elaborate more, should Samantha be disciplined? And what level of discipline is appropriate? Yes, I think she should be disciplined. However, discipline should be progressive, fair, and corrective, not revengeful. Given that she's a valuable nurse with no prior major violations, there is no official social media policy. The recommended action should be a verbal or written warning paired with mandatory social media professionalism training. HR should document the incident but avoid harsh penalties. Why? Because she demonstrated poor judgment, not malicious intent. Without a formal policy, major discipline could be inconsistent and legally questionable. Progressive discipline supports accountability while preserving employee engagement. Sequel to the above mentioned, the need for a social media policy is paramount. How should American Public University Center address the lack of social media policy, one may ask. The lack of social media policy can be addressed by developing a formal and legally compliant social media policy aligned with best practices from Society for Human Resources Management and the ANA. A strong policy should include clear expectations for professional behavior online, rules against tagging the hospital in negative posts, examples of acceptable versus unacceptable content, HIPAA reminders, consequences of violations, and annual training requirements. This protects both employees and organizations. According to the SHRM, clear policies reduce ambiguity and prevent conflicts between employee rights and organizational values. In continuation, balancing expression and integrity. On the last but not the least discussion question, what steps can leadership take to balance employee expression with organizational integrity? Healthcare organizations can take several steps to balance employee expressions with organizational integrity by promoting psychological safety. Employees need safe internal outlets to express concerns within the organization, not online. Educate on professional boundaries. Nurses often want to advocate for patients, but must know how to do so appropriately. Encourage positive social media use. Staff can be ambassadors, however, they will need guidance. Maintain transparency. If budget constraints affect celebrations or resources, leadership should communicate openly to reduce frustration. Ultimately, employee expression is important, but it must coexist with patient trust and organizational professionalism. To conclude, Samantha's post did not break HIPAA, but it did breach professional expectations and organizational standards. A measured disciplinary response is appropriate, but the real issue is the hospital's lack of social media policy. This case highlights the critical role HR plays in guiding employee behavior, protecting organizational reputation, and ensuring digital professionalism in healthcare settings. Thank you all for watching. Please see attached a reference page for further information, and please leave your comments in the comment section. Thank you.